Now to a concern tonight for parents.
Yeah, unbelievable story here. A child is left brain dead after what's supposed to be a pretty routine operation. Last Monday, 13-year-old Jahee McMath had her tonsils removed at a hospital in Oakland, California. Soon after, she began coughing up blood and suffered a heart attack. Doctors say she's not brain dead, but her family is fighting to keep her on life support.
I just kind of feel like maybe she's trapped inside of her own body and she wants to scream out and tell me something. That's why every time I go in there, I let her know I will not let them take you to the coroner's office, Jahee. I won't.
The coroner says having the body on a ventilator will hinder the investigation. That's because a healing body might cover up any medical mistakes.
So this is rare, but obviously an alarming case, raising concerns for parents who are considering tonsil surgery for their kids. It's a reminder that with all surgeries come certain risks. ABC 15 Sarah Goldenberg is live to explain this. And Sarah, doctors say this is still a pretty common surgery.
Yeah, Katie, you know, they're not as common as they used to be, but they're still pretty standard. This is something that doctors perform every day, and they say it's still pretty safe.
Tonsillitis and sleep apnea are just a few reasons children and adults seek out tonsil surgery.
The risks that I talk about with patients include bleeding, infection, and anesthesia.
Dr. David Mendelson is with the ear, nose, and throat specialists of Arizona.
No surgery is without risks. In my opinion, I never tell a parent that this is just a simple tonsillectomy for reasons of just this, because things can happen.
Despite those risks, he says tonsil surgery is generally safe, and the case out of California that left a teenager brain dead is very rare.
What happened in this case was an extremely unfortunate event, and it is a tragedy. I don't know enough details about it, but what I can tell you is that the surgery itself of a tonsillectomy is being done numerous times every day of the week.
Dr. Mendelson recommends monitoring your child after surgery for any unusual side effects like bleeding that could send him or her back to the hospital.
Bleeding is a complication of not only all surgeries, but especially of tonsils, but like I said, it only happens about 1 to 1.5%.
He says those risks are rare and pain during recovery is a lot more common.
It hurts, unfortunately, and we do recommend rest, and it will take probably a good week for them to really start feeling better.
Now, doctors say that parents need to really weigh the benefits versus the risks of this elective surgery. And Katie, in general, we're told that most kids and patients do very well with it.
Yeah, so many tough choices as a parent. Thank you, Sarah.